Assalamualaikum and hi everyone. So this is my team members. My name is Muhammad Aiman Hafiz bin Jamali. My metric number is 2023 826922.
My name is Mikael Edimati Zikri. My metric number is 2023 645186.
My name is Muhammad Ammar Razi bin Ahmad Zaini. My metric number is 2023 456768.
Hi, my name is Muhammad Shakir bin Iskandar. My matrix number is 2023 697 114.
So for today we are going to perform an exercise which is stage by stage from
Initial,
intermediate,
Advanced.
and return to spot.
so let's go.
The pathology and the causes of shoulder injury. Shoulder injuries occur when the structures of the shoulder joint, including muscles, tendons, ligaments, bursae, or bones, are damaged due to overuse, trauma, poor movement control, or degeneration. Because the shoulder has a large range of motion but limited stability, it is more vulnerable to injuries such as impingement, tendon damage, instability, and muscle imbalance. The causes of shoulder injury can be divided into intrinsic and extrinsic factors. Intrinsic factors are internal to the individual and include poor shoulder stability, muscle weakness or imbalance, reduced flexibility, tight muscle, poor posture such as round shoulder or forward head position, previous shoulder injuries, poor neuromuscular control, age-related tendon degeneration, and joint hypermobility or instability. Extrinsic factors are external influences that increases injury risk. These include repetitive overhead activities such as throwing, swimming, badminton, and volleyball, poor exercise or sport technique, sudden increases in training intensity or volume, heavy lifting with poor form, inadequate warm-up, contact or traumatic injuries like fall and collision, improper equipment, and unsuitable training environments. In addition, several contributing or risk factors increase stress on the shoulder. These include overuse and fatigue, poor scapular control, weak core muscles affecting shoulder mechanics, limited thoracic spine mobility, muscle tightness in the pectorals and upper trapezius, weak rotator cuff muscle, poor recovery, and imbalance between pushing and pulling exercises. The muscles most commonly involved in shoulder injuries are the rotator cuff muscles, which provide stability to the shoulder joint. These include the supraspinatus, infraspinatus, teres minor, and subscapularis. Other important muscles include the scapular stabilizer, such as the trapezius, serratus anterior, rhomboids, and levator scapulae, as well as the prime mover like the deltoid, pectoralis major, latissimus dorsi, and the long heads of the bicep and tricep brachii.
this exercise is called the pendulum exercise and it is used in the initial stage of rehabilitation for shoulder injury. The purpose of this exercise is to reduce pain, maintain gentle shoulder mobility, and prevent stiffness in the shoulder joint. The muscles involved in this exercise are mainly the rotator cuff muscle, including the supraspinatus, infraspinatus, teres minor, and subscapularis. It also likely involves the deltoid muscle, but without active contraction.
To perform this exercise, stand beside a chair or table for support. Lean slightly forward and support your body with the uninjured arm. Let the uninjured arm hang down freely, side to side. Gently swing the arm forward and backward. and in small circular motion. The movement should be slow, relaxed, and pain-free, using gravity instead of muscle force.
So for today, I will perform a wall push-up class. What is wall push-up class? Wall push-up class is a simple exercise that helps improve shoulder stability and posture, and it strengthens the striatus anterior and shoulder muscles, making it suitable for beginners, warm-up, and rehabilitation.
First, stand straight facing the wall about one arm's length away. Next, place both hands on the wall at shoulder height. Make sure to keep your body straight and core tight. After that, slowly bend your elbows and bring your chest closer to the wall. Then, push back to the starting position. At the top, push a little extra so your shoulders move forward, and this is what the plus called in the wall push-up plus. After that, hold for 1 second, then relax and repeat.
For the third phase, I will explain the advances strengthening phases. The goals of these phases are to improve the neuromuscular control, strength, power, and endurance. It also to enhancing the dynamic stabilizations and also to prepare the athlete for his activities.
The overhead arm raise is performed by standing or sitting upright with good posture and arms relaxed by the sides. Slowly raise the injured arm forward with a slight bend at the elbow, keeping the shoulder relaxed and avoiding stretching. Lift the arm only within a pain-free range up to shoulder level or overhead if comfortable, while maintaining normal breathing and core engagement. Hold briefly at the top, then lower the arm back down slowly and in a controlled manner to the starting position. The movement should be smooth, controlled, and stop immediately if pain or discomfort increases.
Hi, for now, for return to sport is our goal is to restore dynamic shoulder stability, control, and also reaction. Alright, so now I will show you guys one exercise, which is chest resistance band exercise. So for this exercise, we have two variations, which is first is standing position, and the second one is one knee position. So let's do.
This variation trains rotator cuff muscle, scapula stabilizers, and core, while improving reaction and dynamic control. Standing variation. So first step, stand with feet shoulder wide apart, knees slightly bent and core engaged. Reach the shoulder to 90 degrees flexion, elbow slightly bent. Next, hold the resistance band with the hand, either anchor in front or held by a partner. Next, partner give a quick, unpredictable pull on the band. Catch the force by stabilizing the shoulder without pain. Next, hold the position for 2 until 3 seconds, then slowly return to start. The last one, perform 8 until 12 repetitions for 2 until 3 sets, switching direction of pull. The second one is one knee variation, lower center of gravity. First step, kneel on one knee, like a lunge position. Front leg, foot flat, knee over the ankle. Back leg, kneeling on a soft surface. Next, keep core engaged and shoulder at 90 degrees flexion, elbow slightly bent. Next, hold the resistance band, anchor or partner. Next, partner applies a quick pull on the band. Next, catch the movement by stabilizing the shoulder. Next, hold 2 until 3 seconds, then return slowly. The last one, perform 8 until 12 repetitions, then switch knees. This variation reduces balance demands while still challenging shoulder stability, making it safe step before progressing to standing or single leg version.
In conclusion, this 4-stage shoulder rehabilitation program helps ensure a safe and effective recovery. It starts with initial stage, which is rotator cuff activation to rebuild strength and stability. Next, the intermediate stage uses wall push-up plus to improve control and endurance. In the advanced stage, arm raises enhance shoulder strength and full range of motion. Finally, the return to sport stage includes resistance band catching in standing and lunge positions to prepare the shoulder for real sport movements. By progressing step by step, the risk of re-injury is reduced and confidence in returning to sport is improved.
We hope you can get benefit from this video. That's all from us. Bye.